At the beginning of the day there'll be a huddle, the whiteboard outside the isolation room in the intensive care unit, which is room 4. Any potential patients up on the ward will be discussed, including any problems. Roles will be allocated and any questions regarding PPE or the processes will be answered. And at least 2 people outside of the room. They'll communicate via the phone inside the room on speakerphone, phoned through from the outside.
The first step I'd like you to do is clean your hands, so it's a good 10 cents set, that's right, and keep rubbing and rolling, covering all areas for at least 15 to 20 seconds, and not forgetting your elbows as well. Now the next step is to put on your gown, so you might need some help with this. So this is a new gown that should be available in the next coming weeks or so. If it's not available, we'll be using the yellow gown, but at this stage we're really hoping this gown will be available. It's much better fit, it's more water resistant and it's more comfortable to wear, so it covers much better area around your neck. It needs to be tied into a bow at the back, great. So next step you're going to put your hairnet on and try and cover your ears if possible as well. That'd be great. Excellent. Now we're going to do your mask, so it's really important. You're going to have to take your glasses off to do a proper fit test of. Okay. So open your mask out. The metal bar goes over your nose. So you want to separate the 2 ties. You need to open it so we can put a nice cup, but don't bend the metal bar at the top. So we'll want 1 strap at the bottom and 1 strap at the top. So this is where your body can say it looks comfortable. So with your 2 fingers, what I want you to do, no pinching, I want you to roll and mould to your face, that's it. So no pinching whatsoever. That's it, great. So then once you feel that you've got a nice fit, and sometimes if you don't get a good fit, open and close your mouth while you're doing that can help as well. Just cup your hands around your face and blow up, see if you can feel any air. The longer you've got this on, if you've got a couple of minutes to put that on further, your sweat will help you get a better seal. Next we're going to put on the face visor, and this is going to give you further protection in front of your mask as well. And the final step would be clean your hands and then put on your gloves, because obviously you've been touching yourself. So the last stage is your gloves. We're using, for intubation, we're using sterile gloves because they give you further protection and they're less likely to roll off. Always a good idea just to get your buddy to check over to make sure they're happy that you've got your PPE on correctly and that you're not at any risk there. Great. Keeping your hands so you don't touch any surfaces on the way in, so you keep as clean as possible, and then you're ready to go.
The ICU ANUM is going to be notified of the patient on number 7393, including a rundown of the clinical picture of the patient and the estimated body weight. The primary nurse will don her PPE, will set up the ventilator using the advised settings. The scribe nurse will have already drawn up the medications, ketamine, fentanyl, metaraminol and rocuronium, which can be checked at this stage. And the airway assistant will check that endotracheal tubes, bougie and laryngeal masks are all present. Setting up the breathing circuit and ensuring that the end-tidal CO2 is warmed and ready to use. Also setting up the suction equipment and the closed suction unit. The infusions that will be required after intubation will also be prepared and be connected to a multi-way intravenous infusion device. There are 3 roles within the room: intubator, airway assistant and the primary nurse. We're now ready for the intubation. The patient's arrived. We have a mask with a non-rebreather mask, and underneath that have nasal prongs with 4 litres per minute for apneic oxygenation during the intubation. we're using a rapid sequence with video laryngoscope. The video laryngoscope that we're going to use is the CMAC with a size 4 blade. We're going to avoid doing bag valve mask ventilation and ventilate only when the tube is in position. Of course, if the patient desaturates at any stage, putting in an LMA is an option rather than ventilating with the mask. We only have 3 people in the room at the time during the intubation. The drugs are given with the pre-planned doses, which are written on the whiteboard prior to the intubation. Giving ketamine, fentanyl, and rocuronium for the intubation, and standing by with metaraminol should the blood pressure drop. The bagging circuit is connected to the endotracheal tube, and because everything has been pre-prepared, it's now sealed, and we confirm the position of the tube with end-tidal CO2 and secure the tube in the normal manner. Endotracheal tube position is confirmed with end-tidal CO2, not auscultation. Once the patient's been connected to the ventilator, the patient can be moved to the cubicle where they're going to be looked after and where the nurse who's looking after the patient will be waiting. Arterial line and central line replacement can be put in at this stage.
The first step is to remove your gloves, so if you can roll one down and one over the other, so that we're trying to make as less splash as possible. And the next step is to clean your hands for a good 15 to 20 seconds and making sure you're rubbing and rolling and that's dried before you go to the next step. Our next step is our visor, taking it off from the back. So sliding your hands through, lifting it over and straight into the bin. If you think your hands are contaminated, you may have a lot of sputum around, do clean again. So same again for another 15-20 seconds. And then the next step is going to be our gown. So we're going to untie from the back and then rough it over your shoulders and roll it in, keeping it confined and containing so there's no splash around. At that point we'll rub and roll again. We've got the mask on, so the mask and the hairnet are going to come off. We're going to try and take those off together. So bringing the bottom strap up to the top with the hairnet, bringing it over straight into the bin, and then we're going to wash at this stage. So a good 15 to 20 second wash, just in case our hands were really soiled with any body fluids, and dry them obviously.